Hey everyone, Phil Plisky here from FMS. We have Jenna Gourlay, one of our functional movement systems instructors. In our last video, we talked about low back pain and repeated movements and people who centralize and peripheralize and integrating the current best evidence into your treatment with the SFMA. And as we got off camera, we started talking about the treatment and what we do and what we find. And gosh, we thought that would just be great for people to hear. So Jenna, how do you incorporate the SFMA into your treatment with someone who centralizes and peripheralizes?
Yeah, definitely. So I get that pain down, and we want to see that kind of go from session to session. We don't want to just see it for a few minutes and then say, okay, it's better and just move right along. But we want to see that centralized, and we want to see it stay centralized. Now, during that process, I am going to treat a lot of the mobility findings that I saw when I did my SFMA and my breakouts. So if that's the thoracic spine, if that's the hip, whatever it is, I'm going to be treating those things at the same time. And then when I see that centralization for, 2 to 3 days, and they're able to keep it and they're able to do their daily function and things like that without any increase or anything, then I can just start treating them like a normal patient. And I can start really just getting back into those breakouts and everything, because throughout the whole process, I am going to be looking at, the different parts of the breakout to see if I'm making any change. Because what I've seen a lot with patients is, I may be working on centralizing their low back pain, but during that time, I may see their leg raise get better, or I may see, a locked up hip give a little bit. So there might be a lot of changes throughout that centralization process.
Absolutely. Well, I think that's kind of gets actually at a really good principle of the SFMA, meaning, a lot of times the hips that are immobile and the thoracic spine that's immobile is actually putting so much stress on the low back. It can't be stable because something has to move. So really addressing those issues while you're still doing the repeated movements. Again, there's good evidence for that. That actually probably addresses the underlying cause even better. So really appreciate your time and expertise on that. Thank you so much.
Yeah, definitely.
Hey guys, if you like the video, definitely hit the thumbs up. And if you want to stay informed, hit the bell so we can notify you anytime we put up new videos. And of course, any questions or comments, put those at the end. We'll certainly be checking them out and trying to respond. Thanks so much. And remember, always move well and then move often.